Yajong the Nokuya Shank, we are it to Cousin Doneta, you come what's again, you share Toshilla, Hudo Bay, Bat of Go.
Hola, mi nombre es Alondra Sánchez. Soy consejera aquí en Us2 Behavioral Healthcare y te invito que vengas a visitarnos aquí.
Moi c'est Cathy Constantin. Je travaille pour Us2 Behavioral Healthcare. Moi un clinical therapist. Si aucun monde besoin aucun service, nous carrele 920 903 1060.
So we are a quadlingual organization, meaning that we can serve clients who speak Hmong, Spanish, English, and Creole. And that's critical because a couple of things. One, we know that words do not translate verbatim when you're working with a primarily English-speaking therapist and perhaps like a translator. And so if I'm seeking mental health services, I want to speak to somebody who I know understands my experiences and speaks linguistically the same way that I do.
We have disproportionality in terms of the ways that our students are being identified or not being identified for certain kinds of services, and also in terms of academics and social, emotional, behavioral issues and things like that. We already had to contact Us2 Behavioral Healthcare about a family who only spoke a certain language, and it was a trauma situation and things like that. So they were extremely receptive. They were able to connect with the family right away. And yeah, I mean, that type of thing is very much needed in the Valley. So
we had a Black female on staff who was experiencing microaggressions. She knew it was microaggressions. She knew it wasn't necessarily intentional, but the harm was still done. The harm was done, and that's okay. We can own that harm. So we worked with the person who had done the harm and helped get some training in place, and then we helped facilitate a conversation that was more focused on restorative justice.
Different religions, different cultural backgrounds, different identities with gender or sexuality. I have never seen any place that has such a variety of clientele and that they all feel welcome and included and like this is a safe space. And that's, I think, the most amazing thing of all is that we've created an atmosphere that allows people from so many different backgrounds and walks of life to feel safe. Is really amazing.
When we first were awarded the basic needs grant, I think there were four of us, four full-time employees. By the end of the summer, we should have about 15 full-time employees, including consultants and therapists and more therapists, and a great office to work from, the technology that we needed to do consulting. So the nature of the basic needs grant was incredible, being that it was operational in nature. We could use it to grow, and we were somewhat free to spend it on growth. And we did that.